Hello, doulas. How is everybody today? Natalie, I'm so glad you're here. Stephanie, I'm so excited that you're joining me.
Yes.
So, if you saw our little informational post, you know that we're talking about the westernization of natural birth. I saw Stephanie's blog post and it intrigued me. I asked her if she'd join me. And so here we are. Stephanie's a doula in the St. Louis area. She has a busy and thriving practice. And you've been doing this for how long?
About 8.5 years now.
So, a while.
Yes.
And this is your full time career.
Yes. Yep. I don't do anything else.
Perfect. All right. Well, Natalie, we'll start with you and just tell us what brought you here today and if you had anything specific you were looking for.
Hi. I just was intrigued to listen in. Always looking to hear more from more experienced doulas and just learn all I can right now.
All right, excellent. We're glad you're here. Feel free to unmute if you want to join the discussion. All right, so Stephanie, let's get started. Tell us a little bit about the blog post and then we'll just kind of walk through and talk through this together.
Yeah. So this actually came from a meeting that I had with a client last week. She coined this term of westernizing, natural birth. And I look at it as, um, you know, birth in general has been westernized and that doctors have kind of taken hold of it. And I feel like they tell women they know what's best. They sell them, the services, the products that they need to have a baby and what they believe to be the safest. But then on the flip side, I also think we are getting there with natural birth and that this client seemed very overwhelmed and thinking that she has to do all these things in order to have this birth that she's planning on. And she has a toddler at home, so she's very overwhelmed about having enough time and enough money uh, to be able to do all the things that basically she thinks she should do. And that to me makes it feel like instead of having women be confident into going into birth, it's like now they're dependent on this other system instead of, like Western medicine. So I just kind of went through like it's not that I don't think these things aren't helpful. Obviously, we need all or most of them, but I do think as a doula, it's helpful to help families understand um, what would be helpful specifically for them so they're not overwhelmed and thinking they have to do it all, and providing resources, like if they can't pay for Webster chiropractic care, helping them find somebody that maybe takes insurance in their area. Or in St. Louis, like we have a chiropractic school, so it tends to be more affordable for people to go there if that's, what they need to do. Um, and then just kind of helping them actually gain confidence in being able to do this instead of feeling like they should be dependent on me, to provide them all the things that they need to do or make them feel like they have to be dependent on all this information that they're finding online. Um, so do you, I don't know. Do
Right. And
you
this
want
was
to
a
go?
huge point in yesterday's
Yeah.
discussion was that for a client who has significant anxiety, childbirth education can be completely overwhelming.
Yes.
It's
Yes.
too much, it heightens the anxiety. And if your client in a prenatal visit is kind of struggling to take in the information, then
Yeah.
childbirth ed may not be for them.
Yeah.
But we have others where knowledge makes them feel more
Yes.
in control. But the question is, are we in control in birth? And so we have to assess and find the right class, the class that can help them in the right way for their anxiety, right?
Yes. I always say everything that you do to prepare for birth should make you feel more confident, not stressed out. So,
Absolutely. But I don't think people always know. And anxiety is a tricky one. We'll just go
yeah.
there.
Yeah.
It lies to you. It tells you if you know everything, you're going to feel so much better than you learn everything. And there's more things to think about going wrong. You have
Yep.
more what ifs now.
Yep. Yep.
So, but again, it's like anything else. What's really going to be helpful for this client? Some clients, they have so much anxiety. Skip childbirth. Let's focus on some stress management, tuning into your own body, learning how to manage the things that come up in daily life in a more successful way. That way you can bring all those skills to your birth, and that's going to help you more than knowledge that you don't know how to apply right now.
Yes, I
You
agree.
can't. Your brain isn't letting you apply it right now. It's not, and nobody's dumb. Anxiety just likes to take information and roll with it.
Yes.
Seriously, we get one anxiety thing down in counseling, and sometimes 10 more. It's like whack-a-mole some days,
Yep.
you know? Come
Yep.
on, stop.
Yes.
So I
Um,
think we have to look at all these interventions. Is it the right fit for this client? Does it make sense for this client?
yeah. And so you and I had talked probably what, 2 years ago now, and you had given me good advice on my intake form, asking people, uh, like, do you have time every week to be able to do appointments and to read books? And I asked them to give me information on how much time they think they have and if they'd be willing. And the other part was we kind of talked about was would they be willing to switch providers if we had a discussion and their provider wasn't a good fit? Because I think that's the other part is some people maybe they can't afford a home birth. Maybe they know that's not for them, but then if they think that's the only way to have the birth that they want, telling them they should have a home birth when it's just not gonna happen would make them feel more anxious of, "Okay, now I'm just setting myself up to fail." Um, so I ask that so I can just meet people where they are. No, okay, they're not I don't know, recently I had a client who was just like, "I don't believe in chiropractic care, I'm not going to do it." So it was, I can't push that on her, so we had to talk about other things that I thought would be helpful because her baby was posterior. So, that's obviously we were trying to get the baby to move. So we talked about physical therapy, we talked about spinning babies, and I had to just leave that piece out because I wasn't there to convince her that she should feel okay with a service that she wasn't gonna do. So, um, yeah, so I think by doing that, it opens up the conversation. I I believe like as I mean, they hire you as a doula because they want information. So I present it as in your situation, I've seen people have good results when they've done these things. But leave it up to them if they think they need to do it. I tell my clients all the time, you're an adult and you make decisions every day in your life. And I can't just present that when I'm trying to get you to speak up to your doctor. I have to believe that it, goes along with what I say too.
Right.
Um, so, and they know it. So if that's the decision that they make, I have to be okay with that.
And I think you touched on something really important. We were talking for a few minutes before.
Mhm.
Today's providers are different than they've
Yeah,
been before. The push towards induction, the diagnosis really early in pregnancy of things like preeclampsia, it's endemic, it's
yeah,
everywhere.
yep,
And our clients don't always catch on to what's going on. And it's
yep,
challenging. And there's no perfect provider. I mean, we've
no,
talked about this. There's midwives that don't practice much differently than OBGYNs, and there's OBGYNs who practice very much like a midwife. But it's teasing out and finding those right providers.
yep. And I think for me, the biggest thing is when somebody hires me, that's why I do our first meeting right away. I don't wait because if we have this meeting where we talk about what they want from their birth and we go through, like, I have an in-depth thing of here's all the things, that you could possibly come up that you're going to have an idea of what you would want to do. And you take it to your provider and you take this list of questions along with that birth plan and then leave the meeting and see how you feel because then this allows people time to switch if that's something that they would do instead of finding out at the end that when it's too late to switch. But again, I have to as a doula I have to be okay if they come to me and it doesn't feel like a good fit in my opinion, but they love them for some reason. um because again, they're an adult
Yep.
and they're making a decision for a reason, even though it might be hard for me to understand that. So I think it's good to present the information and just, you know, kind of let them make the decisions. I mean, they have the knowledge, so I feel like that's what we do as doulas. We don't change anybody, we're not there to make decisions for people. We're there just to let them know what options they have. So, um, let's see. I was trying to think.
But it is really super hard to see a
It
client
is.
who
It is.
has this desire
Yep.
and you know the provider, let's just say it's a natural birth, and you know the provider has a higher than normal
Yep.
C-section,
Yep.
or you know their IVF and you know this doctor marks them high risk and
Yep.
pushes starting at 37 weeks to get that induction ready.
Yep.
It's really hard. I'm going to be
Yep.
honest, it's really hard.
Yep.
And then we watch all the things happen, and it's just like sometimes watching a train wreck.
Yes, I agree. And I usually do tell people, give me the top 1 to 3 things that are the most important to you for your birth. And then um if consistently they're like, "Oh, we had this meeting and my doctor brought that up. She knows I don't want to get induced, but said this." I really do ask people to think about that, like, if having an unmedicated birth and not getting induced are your number one things and she's pushing induction right there, the number the number 1 and 2 are going to be very, very hard to achieve. Um, but yeah, sometimes people, I like to say, like, even if you've been with them forever, they're great for other things. It doesn't mean they're the best fit for your birth. Um,
But I think a lot of this westernization
mhm,
is a kickback and reaction to the way medicine is handling
yes.
birth.
Yes. Yeah, I agree. I think now we're feeling like we have to have all the information, which I think, well, I'll tell moms, you're not there to think your way through labor. That's why you hire a doula. A doula is there to do that for you and to remind you of what you wanted and that helping you understand what might come up next, so that you can make good decisions. Where was I going with this? But a mom can't be in charge of that. A mom can't, you're not going to labor great if you're constantly having to think. And I think that's where maybe having too much information can be not as helpful. Because I'll tell moms, if you're asking me if you think you're in active labor, if they list off, is this happening yet? Am I in transition? If you're thinking about it, it's not happening. So you do have to be with people you trust enough to turn that part of your brain off. And if your provider is not that person where you constantly think you have to be ahead of them, then maybe they're not, like you really have to consider whether they're the best fit for you. Um, yeah, because I think sometimes the thought is if I hire a doula, I'm gonna get the birth I want just simply by us being there. Um,
Nope.
yeah, I can't, like I say, I mean, I might be able to tell somebody what you want, but I can't ask them to not, like I can't control what they say or do in your space. We can only react to what they say and do. So, um, yeah, it's not a band-aid for having a poor relationship with a provider. Um, but I do like to be very upfront with that at like interviews and stuff too, so people know.
But we've also turned and said that science is so important and is always right. We've made living with intuition, we've made living
Yeah.
by understanding our reactions, our nervous system responses to things as something that's wrong. And there's plenty of people that live this way.
Mm-hmm.
Not that they ignore science, but that's maybe not the primary factor in making a decision.
Yeah.
And as doulas helping our clients because the world says, but your doctor said, but the numbers say, and they're saying, but I know what's right for me and my baby. I know. I know. And is that legit? Is that a legit way of knowing the world?
Well, no, I'll go through with them like perceived risk, and I think that's been a big part of my care. Perceived risk versus actual risk. Like,
Yes.
perceived is we think this could go wrong. There's a study with people that match all the criteria that you match, and they have better outcomes if they do this, but nobody in your space is going to know exactly what's going to happen, and they can't for sure say if you don't or do this will be your outcome. I tell my clients all the time, I can say I've seen this work 100 times before, but if it doesn't feel right for you, then it's not. And during meetings, I say that again and again. I don't think you have to have a specific class or, like to teach all of this to everybody. I just like to remind them of things that they were right on. Like I just had a client who had a baby at 42 weeks and 2 days, and she went that long with her first. Um, and she picked a good provider, you know, to support her going late. Um, and then her baby was born and she was 7 pounds 9 ounces. And I reminded her that was a good thing you held off on having your baby. Um, there was something in you, whether you knew what it was or not, to know that this was safest for your baby because she was not that big for being that old. So I always like to remind them of little things like that throughout their pregnancy, even. Remember when you thought something might be up and everybody brushed you off and you were right? And so I think that sets them up to know that when they're in labor, it's the same thing. Um, Even if it seems crazy to everybody else. Um, you know, we don't need experts to constantly tell us what we should do. That's putting off the responsibility onto other people for our baby. And at the end of the day, the doctor, the nurses there, they don't hold any responsibility once you and your baby leave.
Yeah.
That will all be on you. Their responsibility, I feel like, is perceived to be when you're in their care. So,
I can't
um,
tell you how many times I've stood in a labor room and the monitor's looking okay. And mom says, something's not
yep,
right. I just go grab a nurse. I push the call button, anything. Sometimes it'll take a minute or two to show up on the monitor, but sure enough,
yep,
every single time,
yep,
it's something that needs attention.
yep, yep. I'll remind moms of that. Like, when I've talked to other doulas who had seen a uterine rupture and there was no signs. The moms just knew. And then everybody thought they were crazy for requesting a C-section and they go in and there's a window starting to open. And yeah, there are physical signs, but it was I think about 3 instances I was told that, you know, and this was between 2 doulas. So this was not a big pool of people, where the moms knew. So yeah, I think medicine, I mean, they don't take that seriously at all. They have to see it. I've even had moms show up and tell nurses in triage that they didn't want to be checked, and the nurses just didn't know what to do. Like, what? I put you in a room just based off what you're saying. I'm like, look at her though. I mean, you can tell she's in labor. Um,
Right.
but we've kind of lost all that because we have to go off these numbers and metrics and everything. So, um, yeah,
And I think as doulas, where does that place us? We feel like we're not valued on the team sometimes. We
yeah,
feel like it's our responsibility to give them all the answers. And I'm not saying that that's a right, but it's a feeling, right?
yeah. I
It's a
think for
feeling.
for me, it's a big stressor anymore of I have to be the one to know all the things and to, you know, to catch all the things before they happen, and that's also not humanly possible because I've never seen this birth before. Just like I tell my clients, nobody in that room's seen this birth before. That means they can't definitively say you should or shouldn't do something to have a certain outcome, but also as a doula, you have to hold that of, you know, it's impossible to predict everything that's going to happen in there. So, um,
But that's even more reason why they need to learn their
yeah,
intuition,
yes, yes,
especially our clients who have, I'll just go back, anxiety, intuition. What am I feeling? And we have to teach them to differentiate those two things. Otherwise, this is so much harder than it needs to be.
yeah. I tell them that a lot of times when you intuitively know you need something, you're at peace with it, even if it was something that you didn't want. You seem okay. Otherwise, your stomach kind of hurts. I mean, you're dreading it and you worry about what other people are thinking. Like, oh, that doctor told me to do that, and if I don't do that, I'm a bad mom. You wouldn't feel that way if you intuitively knew you needed it.
Right.
You would think, okay, I didn't want a C-section, but I feel like this is what's best for my baby, and we're moms and we would do it.
Yep.
Uh, yeah, a lot of times if it's nagging in the back of your mind of if I don't do this, this nurse is gonna think I'm a horrible person, or this doctor is gonna drop me from care if I don't, you know, like those are all worrying about what other people think, not so much being okay with your decision.
Right.
Yeah. I think it's
And
normal to obviously care about and worry about the health of your baby. Like having a C-section's hard and it's not always, you know, healthy for it might be the healthiest option, but it still has risk. I think that's so different than, oh my gosh, if I don't do this, they're just going to drop me from care, or, they're going to treat me poorly if I don't listen to them. That to me is not an intuit. That's not what intuition feels like.
Right.
Um,
And I
but like,
think, again, all these examples point out why I think we are coming to this point of so many
yeah,
products, so many classes, is we don't want to see women keep going this route. Whether you're a chiropractor or a lactation consultant or a therapist or a doula, we're all in this space because we care about women deeply, or we wouldn't be here.
yeah.
It's
Well, and
not
I
like
will,
most of us are making $1 million a year,
no,
okay?
no.
Okay, so we're here because we have deeply in us, we feel like we have a mission and a purpose to make this different.
So I did read this art. Well, I think it was supposed to be a mini class, but I only got to through the first part. But Aviva Ram did a series on burnout and female practitioners, and she brought up one of the first things she talked about is that no matter what you do and what you offer, you always want to be the person to have all the answers and to fix everything for these people that are sitting right in front of you. And burnout comes from the fact that in reality, we can't do that. Honestly, she brought out a statistic. I have no idea how she came up with this, but you're only going to be that person solely by yourself for 30% of the people you work with, because you can't do it by yourself. Even if you're helpful, it's usually you and other people. But we get burnout because we're trying to be the ones to be it all for everybody, and that's impossible. So we have to realize we have to outsource things to other practitioners that aren't in our that we can't do either because we don't have the training or we don't have the time. But like the lady I was working with that actually brought this up, she talked about specifically I can't remember what she was doing, but she talked about chiropractic care. She's just like, I don't know, that's just an extra thing. That's not something we do regularly. So I don't know how I'd fit this in. And I had to give her examples of why it might be helpful towards the end of her pregnancy instead of just telling her, oh, everybody should do it. If you don't, you're not going to have a good outcome. So we talked about baby's position or any type of specific pain she might be feeling, um, like SPD and stuff like that, on why it might be helpful. And then I told her, if insurance would make a big difference, then here are some practitioners in your area who take insurance. So I could at least make it doable for her and not seem so overwhelming. Um, uh, yeah,
That's
so we talked,
another issue when it comes to providers, isn't it?
yeah,
Because insurance,
yes,
whether they're in network, out of network, you've got an agreement between the provider to provide the service. There's a million ways it could be,
yep,
but it certainly makes it hard because when they get to the hospital, they won't know who's providing their care. And if it's in network or out of network, you're kind of just stuck with
mm-hmm,
who they give you.
yep,
And then when you're choosing, you're trying to, I mean, like anybody else, economize. I mean, I'm already paying what, 600 to $3,000 a month for this insurance based on which plan you're on.
yep,
I can't afford to have hundreds of thousands of dollars more added to my bills.
yep. Yep. And that's why I feel like it's helpful to know where they're coming from. Because the other part of it is that sometimes I think it's frustrating to work with people that you think have money and you just can't understand why they wouldn't be willing. But it's priorities too, like some people that isn't a huge priority for them, even if they might actually have the money, maybe it's going somewhere else. So it's hard to tell people what they should or shouldn't be able to find important enough to pay for it, because I just feel like if people really wanted it or really, really thought they needed it, they usually figure out something. So, um, and I've worked for somebody who didn't take insurance because it is hard for providers to get paid,
Oh,
and to
yeah.
make good money. So you're seeing it's more and more of a thing where I think people are, especially chiropractors, are not accepting insurance anymore. So I always keep a short list. Like I said, there's this chiropractic school here in St. Louis that does adjustments for pretty They're pretty affordable. And then I've always got at least one person in every area. Because the other part of it is it's not great for people to drive an hour to see somebody because that's not good for your baby's position. Like the very reason you're going to the chiropractor. Um, so I try to reach out to people in the area so I know who takes insurance. So I don't just have this one person and everybody has to drive really far to see them. Um, yeah, because driving in your car is not good for fetal position. So I feel like it kind of negates the fact that you're
Yep.
seeing them.
And this all goes back to meeting families right where they are.
Mhm.
You know, what are their priorities? Is it just to have a healthy baby and healthy mom? Well, then your job in some ways got easier. They want a positive experience.
Yep,
So at that point, it's framing it out to what's going to make it a positive experience for
yep,
them. What
yep,
makes them feel nurtured and fed and good.
yep,
That's honestly, it's easy. It's just get building in the framework of the experience they want and making sure that they get those things.
yes, I
But
agree.
for somebody who's really, I want an unmedicated birth, it's really important to me, and they have their reasons, we're in a little bit harder space because we can't even predict how it's going to go. There may be 1,000 detours before we hit the end of the road here.
Yep.
We could end up in a C-section with our best efforts.
Yes, and that's what I had put down because like I worked with a lady now 3 times. She's never wanted a prenatal meeting. I know she never reads any of my resources. I know she doesn't do anything to prepare for birth. She gets induced every single time for various reasons. The only thing she tells me is really important is she doesn't want an epidural. She doesn't care how she pushes. She doesn't, and she has the most fantastic births every time. She goes in, they break her water, she has a baby. And I've had other people where they've devoted so much of their time and their efforts and their money into preparing. They do all of these things during their birth and still have an outcome, and I think that's really disheartening as a doula and why I have to very strongly toe the line of every time somebody does this is they have a great outcome. I can't guarantee anything. So yeah, I always just have to word it as I've seen this, in my clients, the ones who have the same type of things happening, this tends, to be a good service for them to invest in.
Yep.
I always say I can't make any promises, kind of like a weatherman, like I can be wrong. Um, but it's possible your outcome. Because to me, I feel like when I do interviews, I tell people like, I hope by having a doula, that you feel confident in all the choices that you made during your birth, even if they were different. You tried everything that was available to you, and this was an option that you felt you chose because it was healthiest and safest in your unique circumstance. Um, and for some people, I think they would want to do all the things, and then they can say, "Oh, well, I did all the services, and I can at least say that I tried." And for some people, that just is not what they want. So or what they can do. Some people just don't have the time or the money, or the headspace. It's
Yep.
stressful for them. So,
Well, and I think that's where building their confidence comes in,
mhm,
right? Is
yep,
look, you're chasing toddlers all day. The chance that your baby position is totally poor, it's
yep,
going to be lower. You're busy, you're active,
yep,
you know, do the things that you do. Take them on walks. Do
yep,
things that fit with your lifestyle,
yep,
nutrition wise.
yep,
Some people, the best we're going to get is some healthy, ready to eat meals. And for some people, it's going to be organic everything.
yep,
It
yep.
doesn't, where are they and what can they do? We celebrate each good choice they make because
Yep,
that's a big, any lifestyle change is a big change for somebody,
yep,
anything they do.
yep. And I do, and I'm the same way. I remind moms who have kids at home that that is the perfect exercise and the perfect lifestyle for pregnancy. Um, You're down on the floor, you're picking you're squatting to pick things up, you're picking up kids, you're running around, you're taking walks. Like, sometimes we've really overcomplicated this process, and, I just always think I always tell clients, "Think about, would you make that decision if you had no knowledge on birth? If you had no expert, if you had no books, if you were in the middle of the nowhere and you had to rely completely on your instincts, is that something you would do?" Because some of these things are, I'll be honest, are or not, like I feel like they've been invented, and I'm not saying that a lot of these things aren't helpful, but intuitively, is it would it make your life harder, and would it make your pregnancy more stressful to add in something that isn't like, that has to be extra? That's why I brought up, like, in the blog, like, instead of thinking you have to have half an hour to sit on this exercise ball every day, just take your dining room table chair away and sit on it when you have meals, or your work computer. Sit on it, there. You don't have to make it into something extra that you have to schedule. Because then we're just making it hard. And then what I see sometimes is when it's too hard, people don't want to do it at all. Because then it's just stressful for them.
Well, yeah, it's like telling somebody to just quit smoking tomorrow. It's
Yep.
such a big thing. It's part of their life. It's part of how they manage stress. It's been their companion. If they're not there with you and totally ready, that's not going to happen.
Yeah.
Guaranteed.
Yep.
But if we said, well, what if you could take out one? Where would you take it out? And what would you replace that with as far as your stress level? Could you take a walk at that time? Could you chew on some bubble gum? I mean, give them, but that small change could lead to bigger changes.
Yep.
But you
Yep.
give them the big change and say, just stop right now. They're going to look at you and go, I can't. I
Yep.
don't know how. I don't know how to live my life without it. I don't know how to manage stress without it.
Yep. Yeah. And sometimes I feel like when you do it like that, people are like, oh, my back doesn't hurt as much. Or, they start to notice good things to
Yes.
where it once they want to continue, instead of it being something stressful of like, oh, I have to do this to have a natural birth. I have to sit on this ball every day. Like they want to do it. And I think that, yeah, that's a good habit forming thing of I feel better or I see the benefit of this. Um, and then it's not so much, oh, I'm forced to do this. Like, um,
Nobody wants to wake up in the morning and think, I have to write my gratitude journal. I have to do my devotional. I
mhm,
have to do a meditation. Then I got to go for a walk. I can't have coffee, so I'm going to have to choose something else. I need a healthy breakfast. I need a shower.
yeah,
And their day just starts to be a checklist of
yep,
things.
yep. And it's
How
stressful.
overwhelming.
Yep. Yep, I'll tell clients, like, with spinning baby stuff, I'm big on that. I'm big on, baby's position can really make or break a birth. Um, but I'll tell them, ideally, you should do this every day, from 32 weeks, 35 weeks on. Um, but do what you can. Like, you should want to do this stuff. Um, it shouldn't be a chore. And honestly, and I always tell them, do it around bedtime because it relaxes your psoas. So then you are sleepy. So then people are like wanting to do it. Like, um, yeah, because it's hard sometimes to understand a goal that you haven't gotten to yet. Oh, my birth will be better, but we just don't understand how bad it has the possibility to be based on baby's position sometimes until you've experienced it. So if they've had that experience before, and that's why they hired you as a doula, because I had this OP baby that I had to push for 4 hours, I had back labor for 30, that might be their motivation. But for somebody who's never experienced that, they don't have
Right.
that motivation yet. So, um, trying to think what else was in here. I'm pulling it up right now to see if there's anything else that we didn't touch on. But I did reach out to this client like afterwards and kind of told her like this whole conversation spurred me writing this blog and I want you to read it. And she said, just by talking about it, just by admitting it out loud that she felt overwhelmed by all of this and having more of a plan of, okay, here are the things to that I think are helpful to focus on, already made her feel better. So, I also think that's why I set my resources up the way I do, because I've cherry picked books or things that I think are helpful instead of I think people are overwhelmed too by everything that's available online and on social media. And so some people want it all and they seek that by themselves. And then I tell my clients, I ideally want you to like choose the things that are best for you, but if you're overwhelmed, that's why I put my list together. Um, so that way it's a one place that you can go and look and you don't like if you're overwhelmed, you don't have to have the need to go elsewhere. Um, like I'll talk about certain books or certain pages, like Spinning Babies is always a big one for me. Um, and weed out certain books, and then I put books by subject too. So if you want more information on this is a good book. I'll even put chapters of certain books, like, you know, that way they don't feel like they have to read the whole thing. And I encourage them to go to their library because they have all those apps anymore to be able to listen to it instead of having to buy it. Yeah, that's huge for me. I listen to books all the time so I can actually live my life and not just sit and read a book. Let's see.
And I'm still that old person that likes to hold a book in my hands.
Yeah.
There's just something amazing about holding a book.
Yeah. Which I own a lot of books and I love to read, but I realized, oh, I drive a lot. So
Yep.
if I can, there's only certain books I can listen to, but I do feel like since those have become more available, I've noticed clients reading them more because I had a lending library for the longest time. And one, as a doula, I felt it was very stressful to get books to people and to get them back. So that
Yes.
was the whole reason I kind of don't have it anymore. But another is like, I just felt like people just, it was something extra. If they really wanted to, they'd read it. But for a mom that's got 3 kids, that, it's hard to make time for that. So I have seen this, since the libraries have come up with these apps, I've seen more and more people start listening to books. And I think that has been helpful, especially if you're overwhelmed by the cost of buying them or owning something that maybe this is your last baby, or maybe if you had more babies, you wouldn't read it again. So, um, let's see. I mean, I think there's a lot of podcasts and stuff out there, but I'm not a podcast person myself, but I do try to listen to them so I know which ones to recommend to moms. I feel like those are specifically really helpful for birth stories.
Yes.
Because Ina May's is great, but it has some outdated birth stories in it. So
Yes.
so, if they're podcast people, which I'm not, so I don't listen to them otherwise, but, let's see. No, I think everything everything in my blog, we kind of talked about. Um, but I really just think the whole point of it was we've overcomplicated how to have an unmedicated birth, and helping clients like rein in um, everything that's out there, especially since majority of us get the information we want or need off of the internet now, which is very overwhelming in researching anything. There's a lot of just moms out there who share, stuff, and there's a lot of doulas who share a lot of free stuff. Um, and I think that can be very overwhelming to a lot of people. So, um, helping them understand, like, based on their needs, like what are the best resources. Like I just had a client hire me and she's a weightlifter and she asked me all of this very specific stuff about exercising during pregnancy. And I sent her to the Mama Stay Fit page because
Yep.
that's what that's what they do on there. So, um, but I
And we
really
don't have
feel,
to know everything. We
no,
don't have to know everything. There's
yeah,
always a resource for it, or we refer them back to their healthcare provider if there's
yes,
more health related questions.
yeah. And I think for me, it's just, I have seen people in that space of if I pay for all the services, if I do all the things, I'm going to have that birth, but didn't negated the fact that they didn't put in the work for it.
Right.
So, I think that's the other part of it is just being dependent on the system of I can, I have a doula, like I do all this, but then I've seen them not be mentally prepared because just because we've paid for a service doesn't mean we've prepared. And there's lots of ways to do it that don't involve having to have an expert on everything for birth.
Right.
I think that was a big point of my thing is we're like we're wanting women to be more confident in doing this without medical experts, but now in some people's minds, we've turned it around to like, but I need to have an expert in everything on natural birth to be able to be successful. And that's not building confidence, it's building dependence on all these other people to give me the experience that only they can actually prepare for. So,
And
um,
it increases their stress because
it
sometimes
does.
experts contradict each other.
Yep. 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 So that's where I tell them, like, when we've already talked about it, you should feel that when you do these things, you're coming out and you're feeling better and you're feeling more confident, not stressful, not confused, like you should understand why you're doing this and it should feel helpful to you, not, okay, I'm doing it because you told me to, but like I get adjusted and I'm in pain, like that's hard to say, like, well, then you need to go back and talk to them about that. And is this the right, are they the right fit for you, or are they giving you the right services? And do you even need to do it? Um, yeah, because we can't buy this birth that we want. We have to prepare for it mentally and physically in ways that don't cost money and don't involve other people all the time. So
And
that
we
was
have
my
to
whole thing.
prepare ourselves to be able to manage because birth is not predictable.
Yes, yep. And I go into a big thing like on my intake form of, how would you feel if something came up during your birth that you didn't want, that you didn't foresee? Like, how would you respond? How have you responded in other ways, and like other things in life that didn't turn out the way you wanted to? And help them have a plan, not a specific plan, because we don't know what's going to go wrong and if anything will go wrong, but just, okay, you told me it's really helpful to talk through things. And maybe that's not helpful for another person. Maybe they just need to pray about it, or, like everybody, but I always encourage clients, both parents, what helps you when you're stressed and when you need to understand more information. So that way I know how to help them, because I'm really big on, I'm not going to come in and dictate this meeting and tell you what you should or shouldn't do. I want this to be an open conversation and you guys tell me what works for you. When I dominate the conversation, that means I believe what I'm saying is most important, and those are the only things you need to hear. And a lot of times, I'll be honest, our conversations might go off a tangent into something else. And I learned so much more about my clients than just saying, all right, we're just going to talk about a birth plan today.
Right. Yep.
Um, they might start talking about, oh my gosh, my mom's been really sick lately, and go into this whole thing, and then I learned all this about how they manage stress and the unknowns of things, and that ends up helping me. So I encourage them to like have that open conversation, because I think that's what makes a doula different than a doctor who just comes in and they have an agenda and we talk about this for 15 minutes and I'm gone.
Right.
So yeah, I always like clients to know, I just like everybody else there, I can't guarantee any outcomes and I don't know what's going to happen, but I do want to help you navigate whatever your birth brings. And I think a doula is just real-time help for that. Like, you can do a class and you can learn all these things, but sometimes in the moment it's really hard to apply those things. It's really hard to think about them. But a doula is going to help you understand what options you have, and make them based on what you like, our relationship, and what I feel like would be helpful for you guys, not just generalize everything. So
Absolutely.
yeah, what makes this
Natalie,
job
do you
hard.
have any questions?
It's just been great to hear kind of that conversation, because I've been kind of just thinking about that challenge recently of kind of navigating the things that they need to hear, but not overwhelming them. And that's just been really helpful, kind of thinking of how to navigate those things. Because you don't want to, the last thing you want to do is cause more stress.
Yeah.
And when there's something wrong, but just knowing how to bring it up and knowing how, I think it's good, like you said, getting to know your client enough to know how they manage something that they're uncomfortable with. Yeah, that's all very helpful.
Absolutely.
Yeah, I think that is the biggest part about being a doula that I find hard is like second guessing, and I overthink all the things of, oh my gosh, I said that to them. What are they going to think about this? Like, because I never want to be that source of stress for them. You know, I just, but then I have to be realistic that I am a person. And sometimes you're not always going to say it in the most perfect way or say the things. So we do the best we can, you know, with the information that we have about our clients. Like recently I had a client who just kept on telling me over text. She never got on the phone with me. Like she made it seem like I don't know if I'm in labor or not. And every time she said that, that made me doubt, oh, is this it? Because she would probably know. And eventually, like she's got a history of high blood pressure. She's been induced for preeclampsia twice. Um, and I guess the reason she didn't talk to me on the phone was because she was on the phone with her friend who was very helpful for her. And her friend was just like, I think you need to go to the hospital. And my client just texts me out of nowhere, you know, of all I keep on thinking was, oh, she doesn't think she's in labor yet. Like, is this what's really going on? And she's just like, I'm worried. It's making my blood pressure go up being stressed at home and if I need to go in or not. So I'm just going to go in. And then she had her baby in the ER at the hospital. And so it was just one of those things of, you know, I was only dealing with the information I was presented with, you know, usually I would have gotten on the phone with somebody, but she didn't pick up the phone. So, but then she turned it around and I spent days and days like, oh my gosh, like analyzing her text and trying to read into things that aren't really there. And then I got there after, you know, I got there when they put her into the room after she had the baby and her blood pressure was really high when she got in there. And when I did the postpartum visit, she was like, I'm so glad it happened the way it did because by you making it feel like it wasn't a big deal, she was like, I wasn't anxious in the car, you know, and I feel like I had an hour drive. I definitely would have been very anxious if somebody would have been like, oh my gosh, drive as fast as you can. And she said, and then my biggest thing was I didn't want to be on magnesium in labor. I've been on it before and it makes me feel awful. And she was like, if I would have shown up any earlier, I think I would have been put on magnesium. And that would have been made my labor work. Like, and everything turned out okay. And so for me as a doula, that's always my thing of like, did I serve them well enough? Did I, you know, did I make them, I don't want to ever be a burden or stressful for them. Like I feel like they got enough of those people sometimes in their space. But also realizing sometimes things happen the way they happen for a reason and we're not always in control of that. So um yeah, so that this has been the biggest struggle for me of giving people the information that I feel like they hire me for, but also not presenting it in a way that they feel stressed and like I'm judging them too.
Oh,
Um,
yeah.
like, oh, I didn't do this, and now Stephanie thinks that, you know, because I didn't do this, this is why my outcome is the way it is. I don't want people to feel like that. So
Yeah, for sure. That's really helpful.
yeah. So I feel like at least presenting it to them as if I've seen good outcomes if people have done this in your situation. You know, people with OP babies or breech babies, if they've done these services and leave it to them, you know, they're adults, they can make these decisions. Um, ultimately, we're not in charge of making sure people do all the things that we think are necessary, but just helping them improve their birth. Like Jamie said, sometimes it's just people want to feel supported no matter how it turns out. So
Yeah, for sure. And I think most people when they're helped do something like that, they always like many people always will feel like you helped them even if you didn't do anything.
yeah.
Um, but yeah, I think my main thing I was dealing with is I want to suggest to two different clients that to switch providers, and it's kind of just hard to know how to bring that up directly.
Yeah.
Um,
Yeah.
but yeah, that's
Well,
just kind of
yeah,
challenge.
and I feel like sometimes like with experience too, it comes to that of if you've worked with them before. I've had clients who wanted this type of birth and worked with this provider and had a harder time. Um, Or like I said, I always have them pick out the top 1 to 3 things of their birth plan that are the most important, and I like to highlight that even, if they put on my intake form that they'd be willing to switch, I'll push them a little bit harder. Even if they said, "Oh, well, at first, no, I wouldn't," but on the intake form, they say they will. So, like, the perfect example I have of this is I had somebody work with a provider that she absolutely loved and consistently, and a lot of people seemingly like her, but consistently my clients have not. And I think it's a story of maybe only the good stories getting told and shared, and the people who have bad experiences maybe feel like they're kind of on the outside, like, like that probably doesn't happen all the time. Um, and this client made a comment at one of our prenatal meetings, like, "But you tell me if there was a problem with my provider," and I did not feel comfortable outright, saying, "Oh, despite how much you love her, let me go into this." So what I did was I sent her an email to set up our second meeting and just included it in the email. Like, "You asked me my opinion, and based on people who wanted the same birth experience as you, here are some instances of issues." And then like 3 or 4 weeks went by and she didn't respond. So then I thought she was mad. And she told me she was like, "Had I opened that up right when you sent it, I actually would have been mad." But then she was like, "But I didn't open it because it was just to set up this I thought it was just to set up the second meeting, and that was gonna be months away. So I didn't look at it yet." But she goes, "I actually went into an appointment today and I was told at 6 months, she's like the baby's gonna be big and she needs to have an induction." And that, along with her opening my email that same day, she was just like, "That was my sign." Like, um so I guess my advice would be if you don't feel comfortable in person, maybe writing it out, um, and allowing people to read it on their own time too. In hindsight, I probably should have told her, "This is what my email says." Um, but sometimes when we say that, it validates what they already know. Because I feel like a lot of times they kind of have signs, and they're like, "Oh, okay, yep, now that you're saying that, yep, I noticed that." Um,
And sometimes when we're asking that, we can expand the conversation, right? So you're asking me what I know. I'm wondering what you're feeling in this moment that
mhm,
led you to ask that question.
yeah,
Pushing it back to them, right? Like we're not going to automatically answer, but what pushed them here to ask that question?
yeah,
What are they feeling? What are they experiencing? And then using that to help them. Well, do you think that it's going to get better? Do you think that that's going to change? And if it were to change, what would that need to look like
yeah,
to
I
make you
actually
happy? We can expand those questions quite a bit.
yeah. There's a really good article. I summarized it in my resources, Pathways, like that magazine that they have a lot of at chiropractors' offices, had a really good article on not just, like, thinking, "Okay, did my is my doctor supportive?" But how do you feel when you walk away from meetings with them? Um, and I can't remember, I didn't include all the questions, but just, like, red flags on how you're made to feel, because sometimes people say the right things. And it tends to be mom's intuition where they're like, "There's just something that doesn't feel right." And that article, I'd have to find it and send it, um, because I used to have a subscription, but I don't anymore. Um, I think gets them to understand, like, that even though they say the things I wanna hear, they word it or there's a tone to their voice that makes them, like, second guess on if it's the right fit.
If you
Um,
can post that in the group,
yeah.
that would be
Yeah, if I
great.
can find it, like I said, they used to have it. I used to get their magazines and the the e-ones too, but I can always take what I have too from my material. It just doesn't have I know I excluded some questions.
No, whatever you could share, I
Yeah,
think would be super helpful.
yeah. Yeah, because that was the hard part about that birth the other day is I told her doula, I was like, the mom just spent the whole birth just telling me like, "Oh my gosh, I've known for a long time this wasn't a good fit," and I think sometimes it's really hard for people to visualize what that can look like. But then for her, it manifested into anytime anybody talked about her doctor possibly coming in to visit her during this induction, she was like physically shaking. Like it looked like labor hormones, but I knew it wasn't. Um, and that to me was like, I've never seen somebody have such a visceral reaction. But yeah, I think it's hard sometimes for people, especially moms who haven't had babies, to kind of understand what this is going to feel like when you're in labor. If it's hard now, it's going to be infinitely harder
Yep.
when you don't have the capacity to like sit there and think everything out and have conversations and um
And I think
Natalie, do you
that's
have
it.
experience with these providers from before?
No, no, I don't. But I've just, one's at
Yes.
St. Clair and one's
Uh,
at South, which I talked to Jamie a little bit. So they're both at not optimal places.
yeah.
One of my clients said that they would be willing to switch, because you talked to me about that before, and that's on my intake form. It was 7, so they're just super flexible, willing to listen, like they just want info, so I'm excited. I think there could be some potential there. They're just from Farmington, so long ways.
Yeah.
But yeah, I think they're, just want to present that in the right way.
Yeah. Well, I did have a client from far away. She was in Illinois, but we had that conversation of, oh, you're traveling really far. Yeah, like you have a lot of options in St. Louis, like I do feel like you have limited options if somebody stays in their area, but I always present it, it's like, wow, you have all these options up here.
Yeah.
Um,
Yeah.
yeah, because I've had a client down in Farmington. She's birthed up here twice. She's gone to Big Mercy. She was with Dr. Gasser the last time. But she had that conversation though too, because I'd been her doula before and kind of asked my opinion. So it was a little bit different. Before she chose him as her provider. So um I just always word it of like, you're traveling really far. So these are the people like that are worth it. And you have so many options.
Yep.
Yeah. Yeah. That's a good point.
Yeah.
Stephanie, thank you so much for
Yeah.
joining us today.
Yes, it was so nice having you have me and talking through this. And I'm glad this blog was helpful um, and spurred this conversation. So
Nice. Well, we loved having you. Natalie, thank you for joining us.